Hi, this is Group 3, and we are going to talk about falls at Southern Hills Hospital. And Group 3 is represented by Philemon Coley, Rayleigh Martin, Stella Opon, Priscilla Owusu, Ashley Washington, and Kaylee Williams. So, first, we are going to look at the overview of quality safety initiatives at Southern Hills Hospital. First one will ask, what is a quality dashboard? When we talk of a quality dashboard, we are talking of a graphic representation of essential information that highlights an organization's performance in a range of designated areas of quality. For a dashboard to be a quality one, it should be able to provide content that aligns with the needs of its users and be designed in such a way that the content is easily understandable to a variety of users. And then it should be able to display timely and correct data in order for it to be perceived as valid and reliable by its users. One would ask what a quality indicator is. A quality indicator is a standardized evidence-based measures of healthcare quality that can be used with readily available hospital inpatient administrative data to measure and track clinical performance and outcomes. While a performance measure is a process of collecting the performance of an individual or an organization. According to the Agency for Healthcare Research and Quality, fall and fall-related injury rates are the most direct measure of how well you are succeeding in making patients safer related to falls. And so if your rates are improving, then you are likely doing a good job in preventing falls and fall-related injuries. However, if your fall and fall-related injuries are getting worse, then there might be areas in which care can be improved. It could also mean that when you first implement a quality improvement program and begin tracking performance, increased fall rates are frequently seen, and this does not necessarily mean that they are providing a worse care, but instead it means the unit staff members are becoming better at reporting falls that were previously missed. In the case of the Southern Hills Hospital, from the data we have, we realize that their fall rate keeps increasing over the period. And so, although we may say that um, because they are putting new initiatives, it's encouraging the staff to report more cases, but we can also say that they need to work on their fall incidence rate. They need to put in much effort so that fall rates could decrease, and that could tell us how they are succeeding in making their patients safe. Now let's look at how the dashboard is used at both organizational and the unit level. So at the organizational level, according to Bacos, Zimmerman, and Morricone 2017, at the organizational level, it is used as an information delivery system that sends a clear overview of quality and safety indicators needed to achieve the desired objectives of the organization. Also, it is an excellent way of providing information on quality and safety throughout the organization. When it comes to the unit level, it is used to provide instant feedback on quality performance. Now, how is data collected? Data can be collected from observations, documents, and records from every unit over a period of time. However, not only um, observations and documentation, surveys are also helpful ways of obtaining data, but for surveys to be helpful, it relies on staff members to record specific events and the accuracy of these events. Medical record reviews are also the easiest approach to complete, but rely on what is documented in the record, and much care for fall prevention may not be documented. And then direct observations of care, where a trained observer determines, for example, whether a patient's call light is within reach, will be the most accurate approach for certain care processes, but can be time consuming. How effective or what's the importance of this process? This process allows for effective monitoring of the fall rate and fall prevention practices implemented to ensure quality improvement. My other colleagues will continue from here.
Hi, this is Riley, and I'm going to be talking about the data results for falls. A fall is descending to the floor in an unplanned manner with or without causing injury. There can be many contributing factors that cause falls, especially in the hospital setting, due to new medications, unfamiliarity to the environment, health conditions, medical equipment, and oftentimes limited mobility. In quarter one, 10 falls occurred. In quarter two, 15 falls occurred. In quarter three, 17 falls occurred. And in quarter four, 24 falls occurred, making a total of 66 total falls. The dashboard contains indicators that need to be measured to see if a problem is indicated. Falls are measured in the dashboard by quarter to be able to evaluate when they happen most often. According to Hazel Hing, 25% of hospital falls end in injuries such as fractures and soft tissue injuries. Patients often develop a fear of falling after a fall. In the past, data has indicated a problem to CMS. CMS developed a list of issues that they would not provide reimbursements for because they are preventable if cared for properly. CMS stopped reimbursing healthcare costs related to hospital-acquired falls in 2008, which actually in turn helped reduce hospital-acquired falls. Hospitals began implementing more preventative measures for falls when CMS stopped reimbursing. Hospitals were held accountable for the cost of falls and injuries that occurred due to the falls, which encouraged hospitals to put more preventative measures such as bed alarms into use.
Hi, my name is Ashley Washington, and I will be discussing the impact and frequent causes of falls. So a fall is defined as an event in which results in a person coming to rest inadvertently on the ground or floor. In the United States, the occurrence of hospital falls are between 700,000 and 1 million cases per year, and this results in patient injury, which causes a cascade of other events to occur. So what are the possible complications of a fall? Well, number one, when a patient falls in the hospital, Medicare will consider this as a never event, and this guideline in their policy considers a fall to be preventable and an event that really shouldn't happen, so they will not pay for these costs that are associated with falls. Now, a fall can add an additional $14,000 in healthcare spending towards the care and injuries of a fall. And a lot of the times, healthcare institutions absorb these costs. So in addition to the costs, falls have the potential to cause severe injuries and in some cases, even mortality. The occurrence of falls may lead to disability, and depending on the seriousness of the injury, it can even lead to early admission into a nursing home or rehabilitation center. Physiological trauma can also impact the patient during a fall, which will cause them to fear falling in the future. Older patients are at higher risk for long-term injury when they fall due to a weakened gait, skeletal system, and cognition. So what are the possible causes of the deficiency? Well, the causes are various, but they can be subdivided into three main categories. Number one, environmental. The likelihood of a fall increases because of the various tubes and cords and equipment that a patient is connected to and they're trying to maneuver around. Number two, physiological anticipation. So patients can have an insufficient gait or previous fall history, and they can even have or be at a current risk for falls upon admission. Number three, physiological unanticipation. So these would be considered neurological problems such as fainting and orthostatic hypotension. And the side effects used for treatment within the various medications prescribed are often associated with side effects that increase the likelihood of falls as well. Research shows that nurses have the largest impact on the reduction of patient falls, and as a nurse, they're deeply involved in patient-centered care. Due to these long-term impacts of falls on the body, brain, the activities of daily life, and the increased healthcare costs, fall prevention strategies should be examined and implemented.
My name is Stella Opon, and I will be presenting on implementations to improve patient care and fall outcomes at the Southern Hills Hospital. So looking at the dashboard, we found out that fall incidents increased every quarter, and in order to reduce the incidence of falling at the Southern Hills Hospital, we are proposing these implementations and strategies to help reduce it. The first point is to screen all patients for falls. So some of these tools will be the CDC Study Tool, the Morse Fall Scale, and the Humpty Dumpty Scale. So the Humpty Dumpty Scale is for children. And using this scale will help you to know that if this patient is at risk for high risk for, moderate risk for fall, or low risk for fall. Also, a research done by Murray et al. In 2016 also shows that 4.5% of every 1,000 patients fail. And after they implemented their strategy of assessing patients every shift, in like assessing all patients for falls every shift at the beginning of every shift, reduce it from the 4.5 per 1,000 to 0% per 1,000. The next point is to increase staff awareness through staff teaching with the use of evidence-based practice literature. So this will actually help with the staff to be abreast with new knowledge in clinical practice. Also, viewing patient history to know the factors that increase risk for fall. For example, if they use medications like sedatives, if they have gait impairment, if they are cognitive impairments, and also if they are taking any medication that will help with their bone build-up. Also, all this information will help the nurse or the provider to know if their clients are at risk for fall before they attempt to do anything which will actually make the patient fall. And then the proper use of assistive devices. So we have to give clients the proper assistive devices that they need. We need to give them like the length of, for example, if it's a cane, we have to adjust the cane so that it will be to the appropriate level and it will not slide or scale so that they will fall. That is it. And also we have to advertise for prevention measures, such as like making posters and placing them at vantage points in the hospital, especially in chatting areas. So as the providers or nurses are chatting, they will have a visual view of they'll have a visual view of the posters, and it will register in their minds also. So there are standard protocols that give all these things, and we took some of them from the CDC, the National Center for Injury Prevention and Control, and the American Geriatric Society of Clinical Practice. Thank you.
Hi, this is Kaylee Williams, and I'll be talking about monitoring change of falls at Southern Hills Hospital. The EHR allows nurses to have easier access to client information and data, which allows for monitoring fall risk patients and the improvement of fall occurrences in the hospital. The amount of falls in each quarter were progressively increasing, which shows the need for interventions. According to David Rivera, data record within the EHR in regards to patient information can improve and facilitate fall prevention. He also says that an EHR scored fall risk tool can be used to assess patients and help keep track and monitor these patients for an ending result of reduced falls. Utilizing the improved accuracy of the EHR scored fall risk tool combined with clinical decision support that guides evidence-based interventions will aid in the goal of reducing falls with injury in hospitalized adults, according to Rivera. Obtaining feedback from nurses who will be implementing new measures to decrease falls and monitoring fall risk patients will be a help to the prevention of falls and the compliance of the EHR. Increasing staffing during implementation periods and adoption phases will help with compliance and decreasing nursing turnover, as well as hospital-acquired complications such as falls and fall reporting, according to Anne-Marie Walker. The EHR monitors change of patient data and is more easily accessible to staff, according to Clemens Scott Cruz. Monitoring patient data is an important part of fall prevention. Monitoring the changes of falls will lead to better outcomes if used properly and accurately updated to show improvement or deficits in falls in the hospitals.
This is Philomen, leading change to improve patient care, being advocate, innovator, and being a collaborative leader, according to William. The author stated that nurses are accountable for their own educational development, growth, and practice. They act on behalf of their patients, family, and community. They also leverage technology that impact delivery and care. They invest in interprofessional collaborative partners. They also impact change by being leaders in innovative thinking and being creative. They also develop innovation in health policies by developing nursing knowledge. They devise a plan to provide feedback to the organization according to law by navigating constant change to stay not only relevant, but also the involvement of nurses in shared government. Nurses also play an important role in bringing in or assuring new concepts in the healthcare environment. They do it by monitoring patient outcome and use electronic health record for documentation, according to Thomas. This is Philomen. Technology's role in improving patient care and hospital performance. Electronic health records had made it possible to quickly access patient data, allowing providers to easily arrive at clinical decisions in the care of a patient, according to William. The author stated also that EMR has also contributed to minimizing medication error in prescribing and therefore improving safety. According to Schultz and Walker, telehealth services have allowed healthcare providers in the University of Iowa to continue to care for their patients' needs during the ongoing COVID-19 pandemic. The end user of electronic health records should provide feedback to the software developers to improve the quality of their product and make it more user-friendly, according to Radwania. This will allow nurses to improve and value time spent with patient versus time spent with computer, according to Nation and Wanjia.
Hi, my name is Ashley Washington, and I will be discussing the summarization of falls. Performance measures evaluate work that is being done so necessary improvements can be implemented to provide better, more efficient care. Performance measures can be very, very useful when used correctly in assisting with patient and staff safety. Observing for performance deficits are really, really important as well in healthcare, because this allows a checks and balance like system to ensure that falls protocol and prevention are being implemented and that patient safety is upheld. How could using best practices improve the deficit? Well, best practices can improve the deficit by assisting with the factors that are actually causing the falls, and it also works to dissolve them. What are the financial implications for hospitals? Well, costs associated with falls are absorbed by the healthcare facility. In 2008, Medicare made a provision in their policy that declined any reimbursement for hospital falls. One study has actually shown that this led nurses to use more prevention methods, such as bed alarms. How is the EHR and informatics used in the process? Well, using the EHR and informatics, falls can be tracked, and through this system, the reason for falls can be identified and solutions can be presented to prevent falls.